Hello, everyone. It is 1 p.m. Central, so we will get started. Thank you for tuning in to today's presentation, Creating an Interactive Child Development Course with Realityworks Specialty Babies. My name is Kelsey, and I will be your moderator for today's presentation. First, here is your 30-second introduction to Realityworks for those of you who aren't familiar with us. We are an employee-owned company based in Eau Claire, Wisconsin that creates experiential learning tools for teaching job and life skills. We got our start over 20 years ago when former NASA engineer Rick Germain created the first RealCare baby infant simulator and then went on to found the company that is now Realityworks. Today, our training tools combine curriculum with hands-on learning tools, student activities, and assessments. Baby is still around, but now you can look to us for our bovine birthing and ultrasound, virtual welding simulator, wearable geriatric sensitivity suits, and if you have some time, we encourage you to check out our website and see it all. Presenting today, we have Denise Dubois, who is the Senior Family and Consumer Sciences Product Manager here at Realityworks and has been with us for over 15 years. She is a frequent presenter, trainer, and blogger for all things related to facts, health science, and human services. Denise has experience teaching in Wisconsin and Minnesota and has over 20 years of education marketing experience and professional development. She is also the co-chair for the Alliance for Family Consumer Sciences and on the Executive Council National Consortium for Health Science Education. Before we get started, I want to cover a couple things. First, today's presentation is being recorded and all attendees will receive a link containing the recording as well as a copy of the PowerPoint slides and free resources. For those of you attending live today, you will also receive a certificate of completion for attending today's presentation. Keep an eye on your email. You will receive that email within 24 hours after the presentation, and we will have time at the end for Q&A, so feel free to type your questions in the chat or Q&A feature located at the bottom of your screen. With that being said, I'm going to go ahead and pass things over to Denise.
Thank you, Kelsey, and welcome everyone. Here's a brief look at what we are going to discuss today. First of all, we're going to take a very brief look at some child development standards because as we introduce each of our specialty babies today, it can help remind us of how we can tie those into using the standards to educate our students. And then in each section, we will be featuring a specialty baby. And then we pulled out an activity that you can take away and try. And there are going to be around 15 different activities throughout our presentation today. So first of all, here are some National Family and Consumer Science standards that pertain to human development, and it's 12.0. And you can see there are 3 of them here that are a terrific reminder as we go through all of our specialty babies today, thinking about how we can use them as a hands-on tool to tie content into human growth and development across the lifespan, but certainly on the front end. As we analyze different conditions that are in these babies and also the different growth and development impacts that some of the conditions have on the infants that you're going to see today. So first of all, we're going to talk prenatal development, and it's a very important stage of development because it's where it all starts. So we have a series of fetal development and birth models that will put models in the hands of students to help create memorable lessons. And we would like to share 3 of these models and an activity from each. First of all, with a fetal development kit, your students are going to get an in-depth look at embryo and fetal development. Students are going to be able to touch, feel, and examine a detailed life-size model of each fetal stage of development. Each of the models is life-sized, and it really helps your students understand the month-to-month developmental milestones taking place in utero. And in a few of the models, the fetus actually can be removed for a closer look. So here's the activity that we would like to share from this one. And to find everyday objects that are the same size as an unborn infant at each month really makes for a fun and engaging activity. And we've got the approximate sizes listed above on the screen in front of you. You could bring in one of the smallest items and place, or one from each month and place them in a plastic bag for your participants to examine. Or if you have the fetal development kit, you could display it alongside of regular items. But you can see some of these are very easy to find. And it's amazing when students think about what's happening in utero at each different stage of development and how tiny they start out and how they grow over the 9 months of gestation. Now, our second model here is the pregnancy torso kit, and it depicts a vertical cross-section of the female pelvis during that 9th month of pregnancy. And it also features a life-size 3-month fetus in uterus mounted on a base for comparison. So the activity we've got here is what we're calling our pregnancy torso activity. First of all, you could print or photocopy and cut out each of the developmental characteristics on the dotted lines of the trimester characteristics sheet available to you on the link above. Then you could write the words first trimester, second trimester, and third on a marker board or chalkboard. Then mix up those developmental characteristics in a container and have students take turns drawing one out and then deciding which trimester it belongs in. Our third model is the birth model set, and it presents an in-depth look at labor initiation. So you're looking at stages 1, 2, and 3, labor, postpartum depression, and pregnancy complications. And you would use a model set like this to educate students on the stages of birth from the first contractions all the way through the delivery of the placenta. Our activity here is what we're calling the birth model set activity, and it can be accessed at the link above. And it provides an activity that's done outside of class time and then shared upon return. So you would hand out the parent guardian interview worksheet prior to class. Then your students can interview their parents or guardians about their birth, or if they're adopted, they could also interview the parent or guardian about the adoption process, meeting the child, adopting them, bringing them home. But they would bring the interview worksheet to the next class, and it would be used in a small group activity. There's also an alternative interview to suggest if they're unable to interview someone about when they were born, they could find someone who has a child and interview them what it was like to go through the birth process instead. Next, the products we're sharing in this section will help your students understand the impact of birth disorders and conditions on an infant. And these babies are some of the most impactful ones that we have. The first one that you see is the Real Care drug-affected baby. By emitting the cries and demonstrating the withdrawal tremors of a drug-addicted infant, this baby shows the potential impacts of drug use while pregnant. And you could use something like this. It's an extremely powerful demonstrator in things like family consumer science classes, specifically child development. You could use them in health classes, certainly parenting education classes. You could even tie this into some health occupations. The activity here we're recommending is to share this brief 3-minute video at the link above on what alcohol can do to a fetus, and then share this slide with students to help them better understand how substances reach the fetus. And even if you don't have the drug-affected baby, animations are a great tool to use with your students and very impactful for them to help understand a concept like that. Our next baby is our fetal alcohol syndrome baby, and this shows the potential physical effects of prenatal alcohol use. The brain models and animations that come with this infant model really bring the concepts surrounding the cause of FAS syndrome and its impact on infants to life. Just really, really a great little package, and it comes with 3 different lessons, but you can pick and choose how much time you have to spend on the topic, but again, a very, very impactful model. Now, here's one activity from that curriculum that you could do with or without having the FAS baby. You could use these 15 questions as a scavenger hunt. You would break into 4 different groups, assign each of the groups a different source from the links above. These include the CDC, Kids Health, FAS United, and the NIAAA. You may also find other sources that you wish to assign. You could time the activity, perhaps maybe 10 minutes, and see who comes up with the most answers. And then you can also see if the answers will match across the various sources of information. Our next specialty baby is our Down syndrome baby. And this simulator helps to increase awareness and understanding of infants born with Down syndrome. It teaches 12 common physical attributes that an infant with Down syndrome may exhibit. Additionally, you could use it to help facilitate discussions. Oops, let's go back here, about the challenges and also some misconceptions that can be associated with Down syndrome. And you can see on here, points out all of the different physical symptoms that could be associated with Down syndrome that you could point out by passing this baby around and having your students really take a closer look. At the link provided above, you can access this brief true-false quiz. This is a great icebreaker, or you could use it to kick off a lesson on Down syndrome. You can read these questions to your students orally, and then they could write down TRF for true or false, or you could do a show of hands to see how many that they get right and just what they do know about Down syndrome. Here's our birth defects baby, and you can use this to increase awareness and understanding of common birth defects, including things like spina bifida, cleft lip, anencephaly, and clubfoot with this specific special baby. Um, and the curriculum addresses topics like risk factors, health challenges, and also misconceptions. And there's no baby out there like it. This is one that we created in-house specific to show what these four birth defects look like on an infant. Again, a very powerful baby to pass around and have your students be able to handle and take a closer look at. Here's an activity you could do on a lesson for birth defects and disorders. First of all, you'd assign groups to create a public service announcement to educate about a specific disorder. You could assign each group a different one, and there's even a link to a recommended rubric above. Now, this is an efficient way to help your students learn about a wide variety of birth defects in a short amount of time. There's a whole bunch of ones out there that you could assign, but this is just, again, a great way for students to dig in, do a little research, but learn an awful lot. Now we're going to talk about some resources that we have to teach about newborn care. First of all, we're looking at our Real Care Preemie Baby. And our preemie baby is a non-electronic manikin, and it simulates a preterm infant born at 30 weeks. And you could use a tool like this to help your students, even caregivers and parents, to understand the unique challenges and sometimes complications and medical problems that can be associated with preterm birth. And it, of course, comes with curriculum and lessons that cover all of that as well. Now, here you could have your students create this grid on a piece of paper that you see in front of you, and your students could count off 1 to 9. You could give each of them one of the questions to answer or find the answer to. And if you have something like 20 to 30 students, you could have several students researching the same question. And that's okay to have different perspectives, as you may find some varying answers. And then students should record what they learn on the grid that they've drawn on their paper. Again, it's a great way to help them learn a lot in a short amount of time. Now, here's our Real Care Baby, our flagship product that really started it all. And Real Care Baby was formerly known as Baby Think It Over about 15, 20 years ago, is really the world's most advanced infant simulator. We've had teachers from around the world use this to teach child development, early childhood education, parenting, infant health lessons, even sex education and teen pregnancy prevention. But this smart baby really adds meaning and accountability because it uses wireless programming to track and report on caregiver behaviors. And things like it will teach infant caregiving skills, feeding, burping, rocking, changing, just even holding an infant appropriately instead of, not supporting the head and so forth. It teaches things like nurturing and the importance of interacting with it. Car seat safety. There's a whole host of things that Real Care Baby will teach when your students have to take it home 24/7 and be immersed in that level of responsibility. It can also teach some transferable career skills if your students are interested in working with infants as a career track. Certainly Real Care Baby is a great first step to building those foundational skills in basic infant care. Now, here's an activity we wanted to share from Real Care Baby. And we know that understanding child development knowledge can be very important as a caregiver for an infant. So in this activity at the link above, your students are going to be given 5 different caregiver scenarios to think about and work through. And the curriculum suggests that this could be a group activity, but it doesn't have to be. So on the analyzing page that you see here, students will critically think how the caregiver responded and what they would do differently. So it also weaves in some great critical thinking, problem solving skills as well. Now let's jump into the world of childcare as a career and how some of our specialty babies can help if that's a pathway that your program teaches. First of all, this is one of our more newer babies, and it's also one of our most exciting ones called the Common Childhood Illnesses Baby. And it offers realistic practice identifying and handling a whole series of infant health conditions, especially those that you may see in a child care center. And these conditions include pink eye, diaper rash, chickenpox, hand, foot, and mouth disease, diarrhea, middle ear infection, and fever. And it also includes curricula with lessons that talk all about each of those different things. And it talks about how to identify these things, how to care for infants that may have these in a whole variety of health-related scenarios. And students are going to get hands-on practice, again, learning transferable career skills needed both in childcare and in healthcare. So for example, pink eye, there's one that has pink eye and one that is clear. They can use, there's an eyedropper to learn how to put drops in the affected eye. One of the ears has an ear infection, and you get a lighted otoscope where you can look into the ear to see what that looks like, and then the other ear is clear and healthy. You can also use the forehead thermometer when it runs a fever. You can program in the level of fever you wish your students to experience. So your students are going to learn to understand what is normal, what's maybe a low grade, and what is a more dangerous level of fevers in an infant. This is our first baby where you can change a blowout diaper, and I'm not kidding. It comes with simulated stool that you can mix to the desired consistency that you then put into the disposable diaper and put on the baby, and your students get practice with changing that type of diaper if they've never done that. And also, you can also see that there's diaper rash as a result if they don't change that diaper, and you can talk all about that. And just you can also just learn how to identify both chickenpox and hand, foot, and mouth disease. So there's a lot of things that you can do with this very special baby. Here's an activity from the lesson on fever. You could use this case study as a whole group activity or even to journal the answers to the questions. You could share one or more of the brief videos about fever from the links above and then read through that case study. Scenario-based learning, we know, is really an effective tool for critical thinking and problem solving, and this makes a great little mini activity for you to use all about recognizing fever in infants. We also have a brand new simulation and entire new program called the Child Care Experience, and this is best described as a pop-up childcare center in your classroom. You are tasked as the student with clocking in and working a shift in an infant childcare room. You are expected to provide care for multiple infants at the same time, just like you would if you worked in a real childcare center. The babies are varying ages because they have different needs. So you've got 3-month-olds and 9-month-olds. You have to feed, burp, rock, change. They get fussy. You have to soothe them. You'll also learn how to do a few different life-saving safety and first aid things, including infant CPR and infant airway obstruction. They come with cribs with each of the babies, a high chair, changing table, tummy time mat. Again, you get the software is already preloaded on the tablet that you get. So you basically set it up and you're ready to go. And we love this because you can start out very basic, learning just isolated infant care skills, and then you can put it in practice mode and do keep adding to that. And then when you do the simulations, they can start out simple and you can learn more complex skills throughout the life of the course or the semester. You could start out with a smaller ratio, perhaps one student to two babies, and work your way up to 3 or 4. You can make the scenarios more difficult with overlapping events so that they have to learn to prioritize and multitask. It is a fantastic experience, especially if students wish to work in a daycare or with infants at all. Many times, students can't work with real young children under the age, preschool age. They're just not allowed to do that. So this gives your students a chance to, in the most realistic way possible, work with infants in a childcare kind of a simulated work-based learning environment and learn some skills that if they decide that's a career that they'd like to do, it should feel somewhat familiar when they someday are working with infants in a real childcare center. So this activity comes from the curriculum and focuses on the developmental domains of infancy. And it is a PIES, which is physical, intellectual, emotional, and social case study focusing on those parts of the development of an infant. So the case study is going to describe an infant. You'd read the information and then you'd complete the chart by identifying examples of how the child is demonstrating these specific areas of development. You could have your students create a pies chart with 4 columns that looks like the one above, and you could read the case study and have them complete their chart. And we've provided you with the answer key here for reference. So again, a nice little activity that you can take and try with your students. Now we're going to show some of our child safety and first aid specialty babies. Our first one here is Real Care Shaken Baby. It's a simulator that helps young people understand the effects that only a few seconds of shaking can have on an infant's brain and how to safely soothe a crying infant. And it's a powerful visual because when you shake that baby, the simulator's transparent head is going to illuminate and illustrate just where the brain damage has occurred. Um, and this is the teacher's going to use it for the demonstration, but then students can get their hands on it and use the included swaddling garment to practice soothing the simulator, which will stop crying when the swaddling garment is correctly applied and they rock the infant. So a couple of different uses, comes with some great lessons, but very, very powerful. And it's a lesson that your students are going to remember. So even if you don't have our Shaken Baby simulator, you could still teach a very impactful mini lesson on Shaken Baby syndrome, now also known as abusive head trauma. First of all, you could play the 1-minute clip that we have above in the link. And then next, if time allows, you could play the 13-minute When Babies Cry video. And this video includes interviews with physicians, and it also goes into what is happening to the brain during a shaking. It also features several survivors of Shaken Baby syndrome. And after you do that, then you can have a discussion on different ways to soothe a crying infant. And then students should begin to complete the 5 S's of soothing worksheet questions. You could then finish a lesson like this with a brief video on the 5 S's of soothing. And we have included one such link for convenience on the slide that you see in front of you. Next, you could see our choking baby. And this teaches the correct technique for dislodging an object from an infant's windpipe. And you see the choking object is lodged in the throat. And then when you do a series of back slaps and chest thrusts, the object is expelled. Now, this activity comes to us from the Choking Baby lesson plan, and it helps students learn what would be a choking hazard to an infant or a toddler. And this is going to require a little bit of work for instructors to gather a variety of items that are safe or unsafe and put them in a bag. And then you complete the what's in the bag activity as shown above. Another spin to this, you could even ask your students to bring in a couple items that they think would be safe versus unsafe and put them all in the bag. And then you could have discussions as you pull things out, what truly is safe and what is not. Also, we have an infant CPR manikin, and you can use this to get hands-on practice performing infant CPR. And the lesson goes into the correct procedure where you're doing the compressions, and you're also doing the breaths, and it talks about how the ratio of breaths to compressions and how deep to go and how fast to go. And it's just a really good hands-on practice manikin. If your students ever find themselves around an infant that needs CPR, this is a great tool for them to get that hands-on practice first. So even if you don't have our CPR manikin, you can still show the infant CPR procedure via the link above, and then you could print out a free handout or poster of the process for infant CPR at the link provided. So you can see we've got the link for that poster and then a brief infant CPR video. And it's just a really nice, engaging little mini lesson all about infant CPR. Now we've got a little bit more that we'd like to share with you before we wrap up things and go to Q&A today. First of all, you can access a free lesson from our child development online course to try with your students. If you click on the link that we've provided where it says unlock your free trial, there will be a method that they will send one lesson to you that you can try with your class as part of this online course. And the online course is very robust. There are 25 different lessons, and it's just a really great asset to augment what you might already be doing in your program. And if you're looking for a wonderful resource that can cover a wide breadth of things that maybe you don't have lessons or resources for, you could purchase this, and your students would have a great many lessons and activities that they would be able to do on their own. And here are a few more free resources from Realityworks that we would like to have you check out. First of all, we do webinars just like the one today, each and every month. If you can't attend live, please do register because we always send out the link and of the recording that you can watch at a time that's more convenient. We have free posters and infographics specific to early childhood. We have implementation guides for both the child care experience as well as our Real Care Baby programs. And then, of course, we have some career exploration lessons. And if you're looking for lessons specific on childcare careers, there's some really, really good ones located at the link above. And I'm going to turn it over to Kelsey to wrap us up before we get on to the Q&A.
Perfect. Thanks, Denise. So while we wait for some questions to roll in here, if you are interested in connecting with your local Realityworks account manager about starting or refreshing your own program, you can scan the QR code on the screen. You can get a free quote, ask questions and more. Just gets you with that account manager, help you start that program. So now we will jump into some questions here. So first question I have is the common childhood illnesses baby suitable for all education levels?
That one I would say yes. There's nothing they can do to it that's going to hurt it, and it's a silicone made baby. It's beautiful to hang on to. It's got some weight to it, but there are so many hands-on things that they can do with it. Even into middle school, it would be a really good career exploration, even if they want to work with infants, whether it be healthcare or social work or even childcare. It definitely could also go into community college level if you're looking for additional things that you can bring into a childcare certification or pathway program. That's a really good one.
Great. Another question we have is what product would be a good place to start if just beginning a child development course? What would be like one or two products that would be a good place to start out of these?
Well, it depends, of course, budget and how many students you have. Um, the common childhood illness baby, I have to say, is a really good one for on the health side of things, being able to recognize when an infant is not healthy. But certainly, Real Care Baby is probably one of the best foundational pieces that you can have in a program that teaches all about, providing basic infant care for a healthy infant. So if you had just both of those babies to show and put in students' hands and learn a few skills. I think at a very basic fundamental level, those two would be an excellent starting point.
Awesome. And then just one more question about in regards to a shaken baby. Is that battery operated or a rechargeable infant simulator?
It is battery operated, and the batteries do come with the baby. And when the batteries eventually run out, and I mean, we're talking years down the road usually, you can replace them, and there's an instructor guide that comes with it that shows you how to do that.
Perfect. Well, I am not seeing any other questions at this time then.
All right. Well, thank you everyone for spending the time with us today. Learn about all about the specialty babies that we have to offer and keep your eyes peeled because in early 2025, we are also going to be unveiling another new specialty baby. I'm not going to talk about it now, but it's there. We're always adding to the lineup. So appreciate your time today and thank you very much.